When it comes to dissolving, what are the most common reasons that you're seeing, either in the sort of mainstream broadcast world or even in your personal clinical practice?
I would say that a bad workman blames his tools.
Yeah.
People dissolve way too easily, often too frequently, and often they don't even need to treat the area to dissolve in the first place.
Yeah.
When you do dissolve, obviously you can never accurately dissolve. You can never really scatter the hyalases and accurately get rid of
you have
the
no
area.
control once it's in the skin.
Because you can't see. Microscopically, there's always going to be some element of filler place that only an MRI can pick up.
Yeah.
And of course, we know it expands. So people dissolving prematurely, I would say the best strategy really is to first of all select the right candidate. And when you see them, you don't need to do that full face each time. If I was to see somebody today do a 6 mil transformation, in 18 months, I would use 3 mils to maintain it. Whereas people are dissolving and refilling, or overfilling and having to dissolve to refill.
Yeah.
It's, as you say, it's all candidate selection.
Yeah.
The biggest issue in this industry right now is people are simply not trained in artistic proportional balancing.
Yeah.
If that could be fixed, the world of fillers will have completely, it would have never succumbed to what it is now.
I mean, I'm going to play devil's advocate. I agree with you, but I'm going to play devil's advocate. The issue with everyone being toward the artistic side, there will always be people that will just say yes.
Yes.
And I think we will never be able to stop that. But I agree with your thought there. And in terms of the artistic side, is it something that you can actually learn?
You can learn it, whether or not you can apply it to something else. I mean, there's always, the clumsiness is something you can't teach.
Yeah.
If somebody's naturally clumsy with the way they hold, I mean, I see a lot of injectors, and I can always tell by assessment the way they use their non-dominant hand.
Okay.
Your non-dominant hand is as important as your dominant hand. The way you hold, the way you measure, the way you pull back. Can you teach? You can teach proportion. You can teach some element of artistry, but then your ability to apply it has to take years. Some people either have it or they don't. Within seconds, we can tell this person's got it.
Yeah.
All right. So what's a shame really is that we see a lot of artistic injectors, but they're shy. They can't market. They can't communicate. They can't sell.
Their confidence in themselves.
There's multiple aspects that go into succeeding, and artistry is only one of those.
Yeah.
Saleability, communication, marketability, communication. All that has to come into play.
Yeah.
But can you teach it? You can. I think you can teach it, but applying it is very different. I can teach you, for example, how to shadow and contour and sculpt.
Yeah.
But will you be able to get it accurately or evenly? Probably not. And that's subjective.
Yeah.
And that's what there's always be that distinguishing factor between injectors who are naturally more artistic and detail focused and those that aren't.
I think that's what makes the difference between people that have a long lasting career and those that give up at some point, or people that become truly prolific and great injectors rather than run of the mill, your bog standard average clinic as well.
And it all comes down to detail.
Yeah.
When detail appreciation in any industry distinguishes good from great.
Yeah.
And to understand detail and proportion, you need to really appreciate where things are lacking.
Yeah.
It's like filling in the dots. And that's what drawing teaches you.
Yeah, 100%. 100%. I was never really good at drawing though. But in terms of the dissolving, there are people that talk about horror stories, I dissolved it and I looked terrible afterwards, etc. I have my opinions on that. I think there's actually a scientific process that is going on, which is a whole big discussion in and of itself. I'm just curious from your personal practice, when you do dissolve, I would hazard a guess that when you're dissolving at something that you've done, you don't have a horror story. You just have someone that gets to where they want to go. When people do dissolve and, it doesn't quite go well, I've got my thoughts on this, I've seen the scientific basis behind this, but just curious in terms of your thoughts, why do you think people are having that happen? Do you have any thoughts in personal practice? Do you have any thoughts from the scientific perspective? Anything?
The first thing to mention is the molecular weight of dissolving hyaluronidase is very low.
Yeah.
So where you place it is really going to impact how it's going to look in 2 weeks.
Yeah.
You can over-concentrate, under-concentrate, you can put it superficial, you could put it deep, you can put it with a needle or a cannula.
Yeah. Even dilution.
Or and the dilution impacts it. So I think dissolving really itself is a skill, and dissolving should really be plan Z. You should try all other avenues before you get to a stage of dissolving, including warm saline, or molding it down. If you get to a point of dissolving and over dissolving, we've learned that you can naturally take away your own hyaluronic acid, especially in delicate areas like the eye.
Yeah.
So you can dissolve everything, and suddenly the skin's worse.
Yeah.
So rather than refilling, you have to address the skin. So laser treatments for actual, skin boosting, Sunnicos, all these other things that actually work on other aspects. So you sometimes create a problem for yourself when you dissolve, and it becomes harder to get that finish at the end.
Yeah, I mean, I think when it comes to the dissolving of the endogenous hyaluronic acid, I agree with you. Yeah, it's going to have an effect, but also that's turned over anyway. So my view on that is, I agree, but I don't think it's as bad as the other stuff in terms of the overall aspect. I mean, there's a paper by Caroline Weil and Daniel Ezra back end of 2024, I think, and they looked at what happens in these things. And I think in the cases where you dissolve and maybe things look caved in, it's not that the dissolving did that. The filler did that. And the dissolving just shows it up because you can see it now. And they did not just ultrasound, but MRIs and 3D MRIs where you can actually see that actually happening. So I think the dissolving, 100% agree, it's a skill in of itself. And the instrument you use, the amount, the dilution, the massage even potentially, things like that, they all play a role. And my view is the dissolving itself may be responsible for some level of minor damage, but it's going to show up the damage that is being hidden by the filler in the first place.
Right. Okay. Makes sense.
But there's not enough evidence to show, because I mean, that one paper, as brilliant as it is, there's not many more like it. And I think we need more people to think about it and do experiments to show that. And
you're right. Most of the views around design are anecdotal.
Yeah,
it's based on opinion and experience.
Exactly.
Whereas we haven't got these, RPs that are showing what happens with it over the years.
Yeah,
we are seeing MRI studies showing that filler can retain.
Yeah,
we're not really assessing and examining the hyaluronidase effect.
Yeah.
So I mean, we don't know.
Yeah, and they do call it the hyaluronidase effect or the hyaluronidase effect. And it's actually a very, very interesting reading. And I think it's actually changed my practice quite a bit as well.